Hello, viewers. Welcome to today's special podcast where we talk about institutions that have shaped the healthcare landscape of Pune and Maharashtra. One name that stands tall is KEM Hospital Pune. With a rich legacy spanning decades, in fact, more than a century, KEM Hospital has consistently combined compassionate care, clinical excellence, and path breaking research to serve thousands of patients across the region. From its humble beginnings to becoming a trusted tertiary care center, KEM Hospital Pune has built a reputation for affordability, ethical medical practice, and strong academic contributions. Its various departments have evolved into recognized centers of excellence, supported by a dedicated team of doctors, nurses, researchers, and healthcare professionals. In today's conversation, we will explore the remarkable journey of KEM Hospital Pune, its legacy, its present day innovations, and its vision for the future of patient care and medical research. Stay with us as we bring you insights, stories, and perspectives from the people who continue to drive this esteemed institution forward. It is our pleasure to welcome Shirin Wadia, the Chief Executive Officer of KEM Hospital Pune. Shirin began her journey with KEM back in 2001 as a medical social worker fresh out of TISS. After gaining early experience here, she went on to complete an MSc in Public Health from the London School of Hygiene and Tropical Medicine. Shirin then worked for a year with the MRC Epidemiological Research Center in Southampton, following which she spent 8 years for the Ministry of Health's Health Promotion Board in Singapore. In 2013, she returned to KEM, bringing with her a wealth of international perspective and a deep commitment to ensuring quality and accessible healthcare. Over the past 13 years, she has played a pivotal role in the hospital's growth, rising through the ranks from Deputy General Administrator to General Administrator and now serving as CEO. Shirin Wadia continues to lead KEM with a vision rooted in empathy, excellence, innovation, and inclusivity. Welcome, Shirin, to the show. It's a great pleasure to have you here. And I am ready with a couple of questions that will interest our viewers. So my first question to you is, KEM Hospital Pune has been serving the community for decades. How would you describe the journey and legacy of KEM Hospital in shaping healthcare delivery in Pune and beyond?
So thank you for having me. It's great to be here. KEM, as many people know, probably started with just 4 beds. There was a philanthropic family in the neighborhood who wanted to start something and decided to donate their own land, the Mudliers. So they donated this piece of land, and they wanted it to be to start off like a small dispensary, which then grew to focus on maternal and child healthcare. And in 1944, when Dr. Banu Koyaji was asked to come in as a locum for the then dean who had to go away on maternity leave, she came in on a bicycle, and that was it. She never left. So she was actually responsible for, with her vision and foresight, gathering around her a really wonderful team of doctors who believed in the same vision that she had, and who then started to grow specialties in the hospital. So while it sort of then grew from being maternity and child focused to general hospital with all the basic specialties of medicine, surgery, anesthesia, diagnostics, pathology, etc., it very soon developed subspecialties and very niche care areas which were not available in other parts, not just of the city but also of the state. So things like pioneering pediatric surgery, for children with something called an extrophy of bladder. So kids would come from all over Maharashtra for this to one of our surgeons, Dr. Govind Datar, who was a pioneer. A lot of pioneering techniques in anesthesia and pain management in the early days. Dr. Kurus Koyaji, who took over from Banu Koyaji, was responsible for a lot of pioneering work in cancer, early cancer surgery. And these are some of the things that are not known. And KEM then became a center where people would come for not just good quality care, but also for very high risk cases, for things that actually nobody else wanted to touch. And a lot of credit goes to the people and the leaders who at that time gave the teams that they worked with the freedom and the opportunity to really innovate and yes, to some extent take risks. But I think then that is how a great institution really comes about. So it spans over 113 years of growth and innovation. So being ahead of its times in a lot of spheres as it was growing.
Very interesting and very inspiring. Some of these facts none of us know, although we've been Punekars for so many years.
Yeah.
So it's lovely to hear that. Can I ask you that over the years, what core values and guiding principles have helped KEM Hospital build trust and credibility? Because these are very strong hallmarks of the hospital. So how have they gone on to build trust and credibility among patients and medical professionals?
So I think the answer actually lies in your question, because I think the basic focus of that would be trust. So trust and openness and transparency in everything that we do. And it has always worked on the principle that we don't turn people away because they can't afford quality healthcare. Because our vision is to ensure that everybody has access to healthcare. I think that is one of the crises that we're dealing with in the environment today, in the social political climate. Accessibility to good healthcare is a big problem. And KEM has always worked on this one principle. So I think a lot of our growth and the fact that we have been able to do what we have been able to do, we have treated generations of people. You know, you bump into somebody and they say, where do you work? And you say, oh, I work at KEM. Either they'll say, I was born there, or my grandfather was born there, or my grandchild was born there. So it really is an institution in the city, and in some cases even a household name. And I think that, you know, just the people who work there have helped to create that atmosphere and that trust, which enables people to come back to us for care.
How wonderful. So it's like a generational trust, you know, it just passes on from generation to generation. That's lovely to hear. What is the key transformation you have in mind that would shape the hospital and your legacy over the next decade? And could you outline your vision for this?
So I think one of the big focuses today has to be on data-driven care and diagnostics and clinical service. I think that is very important. But while one embraces innovation, technology, and of course now, I mean, you know, in the medical sphere, obsolescence is literally every 2 years.
Yes.
You know, you've got the state of the art something, and then in 2 years something changes, and you know, you bring something else in. There are so many hospitals mushrooming across the city. There is, you know, sometimes you have to guard against there being a glut of something, and you have to maybe focus on certain areas where you have core specialties. And then of course there's AI, and I believe that has to be used very responsibly. So we need to embrace it, but we need to embrace changes in innovation and technology very responsibly, because I think in healthcare specifically, nothing can really replace the human touch. So I know perhaps my thinking is not the same as many other CEOs across the board. But I do believe that it's important to have a balanced and thoughtful mix of AI and data and the use of this data, and then use it to drive excellence in clinical services. So my vision really aligns with the vision of the hospital, which is to be a modern state of the art clinical space, but completely human centric and inclusive. So that is I think transformation implies maybe that it's something that you want to change and grow into, but I think that what I really look at doing is continuing to shape and grow this legacy to ensure that it embraces the best of what is modern and new and out there, but does it in a sensible, responsible way.
Yes. Yes, I think that is a very balanced approach, because with the kind of technology that is engulfing the entire industry in every which sphere, embracing it in a balanced way is something which is truly a good approach. And what is your long term vision of KEM Hospital in terms of, you've answered most of it, but in terms of innovation, technology, and patient centered care?
So I think the important thing is to remember why we are at KEM. Why are we all a part of this team, and what is it that makes us want to be there? And I think the focus of all that is the person that we're there to heal and help. And I know today it's not very popular to say patient, but we use it for want of maybe another word. But at the center of it all, and at the center of everything we do, is the patient. And I think that it's important to know that whatever we're looking to drive, however we're looking to grow, whatever we're looking to embrace, ultimately has to benefit this person in the best possible way. So you have to balance a lot of things. You have to balance economics. You have to have responsible healthcare costing. You have to be data driven. You have to look at all these things and bring them all together to ensure that the person who is at the center of it all feels that they have had a smooth journey, that they have benefited from this, they feel better at the end of it all, and that they've had as smooth or good an experience as one can in a hospital. I mean, nobody comes there because they want to be there, but it's our job and our responsibility to ensure that it's a smooth journey, bringing together the best of what is modern technological advances, innovation, allowing doctors to feel empowered to do things. I think that is also a strength that the hospital has. It has always allowed people to innovate. It has always allowed people to bring in new techniques and new ways of doing things. A lot of clinical care depends on also the skill that you have in your hands, and it's not just surgeons who are sort of when we talk about the skill that you have, it's about how you perform some very complex surgery or how you stitch somebody back together again. But it's also about people who maybe are not surgeons, but in other spaces like diagnostics, or good physicians, or a good psychiatrist. Mental health is something that we also need to look at and focus on today. Gender issues, all of these things. So the vision that I have for the hospital is an institution that is known as a healthcare delivery institution, more than just say a tertiary care hospital where you come because you have a disease or an illness. But it's a place that looks at the human being as a whole, and we focus on all sorts of things. We also focus a lot on mental health issues, on awareness building, on the reduction of stigma. For example, suicide is a big issue today in the environment around us. Children, the effects of AI, now looking at AI from a different lens. And I think we are all responsible in a way for ensuring that whatever we do ultimately looks at focusing on the person and how it's going to impact the person positively.
So, what emerges from whatever you've told us is a very strong word which centers around responsibility. So, responsibility is something which is uh, something which we cannot really compromise with. There are no two ways about being responsible. So, there's only one definition to responsibility, if I may say. Drawing from here, what does responsible healthcare leadership mean to you in today's social and economical climate?
So I perhaps sound a bit repetitive, but for me, the one word or the two words would be ethics and values. I think that you can have the best of everything. You can have the most modern technology. You can have the most number driven practice. But without a core sense of honesty and integrity in everything that you're doing and delivering and putting forward, I think leadership and responsible healthcare leadership would be missing. So I think that in order to be a responsible healthcare leader, and especially in today's social and political climate, the main focus would be on ethics and having a principled vision and driving that across one's team and ensuring that everybody pulls together towards that one common value driven goal.
Absolutely. Yes, so whatever you said reinstates the trust of people. It goes towards forging that trust which is already there. And it's wonderful to hear this. With this, I come to my last question. In what ways has KEM Hospital contributed to medical education, training, and capacity building in the healthcare ecosystem?
So I think COVID serves as a great example to answer your question.
Yes.
You know, it just happened. Nobody ever expects a pandemic to come the way, it eventually does just come upon one. And so everybody was scrambling. We had to scramble to make infrastructural changes. We had to scramble to absolutely really change a lot of things in the way we were functioning, shift timings, how to accommodate staff within the hospital, how to ensure that older staff was safe, people who have healthcare issues are not compromised, etc. But the interesting thing about how KEM has contributed to healthcare capacity building and training lies in the fact that I got a call from one of my staff members during COVID, whose mother and brother were stranded in Vishakhapatnam. And nobody, no contacts, nothing. And the beauty about KEM and working in KEM and with some of the doctors who've been there for over 3, 4, 5 decades is that you just reach out to somebody and they say, oh yeah, I have a student in Vishakhapatnam, I have a student in the interiors of Maharashtra who's now opened their own dialysis center. One of my students is in Calcutta, one of my students is somewhere in the northeast, and we were really able to help so many people who not 6 degrees of separation, but sometimes there were like 16 degrees of separation. I was in hospital with COVID myself and got a call from somebody I barely know to help somebody he doesn't know at all. And one of the things that we were able to do and why we were able to help so many people across the country, actually, I would say, is because I was just able to pick up the phone and reach out to one of my senior doctors and say, you had a resident who worked here 25 years ago who's now set up something and become a really big doctor in his own right, or set up a really established practice somewhere. Or you could reach out to that person and say, get this patient help somewhere else. And it was really a testament, I think, to what the hospital has done, not just for patients in the city and across the state, but what it has also done, I suppose, in a larger sense for the community at large, because we've been able to train people and put them out there. And so in a sense, the hospital has just continued to pay it forward. So not only are you helping people and healing people themselves, but you're creating healers for the future. So I think that is one of the um, biggest ways in which the hospital over the last century has been able to contribute to the community at large and to society.
Truly wonderful. These facts truly enlighten us what goes behind the scenes, what is your vision, and how KEM moves forward with leaders like you. It's truly inspiring to hear that. Thank you so much for joining us, and we wish you all the best, and we wish KEM Pune all the best too.
Thank you very much for having me. Thank you.